I'm Julie Lago, the Executive Director at the National Center for START Services, and I could not be more excited to have Marcus Appolon joining us today from Temple University's Crisis Response Center in Philadelphia. Today, we are actually going to be kicking off our series, The Stories of START. It's been a vision for quite a while for us to be able to come together with members of our community to hear how our START programs and START services are impacting our community. And recently, I went to our Philadelphia program launch and had the opportunity to meet Marcus. We had an instant connection, and Marcus does some wonderful work in the community. I'd like to give you the opportunity to introduce yourself and tell us about the great work you do, and then let's talk about all the fun we had a couple of weeks ago.
Greetings, Marcus Appolon. I'm the nurse manager at Temple Health Episcopal Campus Crisis Response Center here at Temple University Hospital. I serve the inner city. We are one of 5 crisis response centers that serve those who are suffering from mental illness, and whether it's involuntary or voluntary services we provide. And for those who are unfamiliar with the Crisis Response Center, a simple way to look at it is it is a psychiatric emergency center.
Wonderful. Marcus, when we were at the launch, you were so kind in coming up to me and making an introduction. And my favorite thing about these community events that we do through NCSS is networking. I love meeting new people. I love meeting members of our community. And you hit the nail on the head because you shared what's going on in the Philadelphia community that I just wouldn't have known otherwise. And you shared so much about what you do at your center, and you then invited me to come visit. And that was wonderful. I couldn't get there fast enough. I was so excited. You walked me through the patient experience. You walked me through the door that people would walk through and how would they see the center for the first time. But I was incredibly impressed by the focus on the whole person, making people comfortable seeing the person, dignity, respect. That was felt the minute I walked in the door. So coming from that perspective of the work that you do in mental health and clearly the focus you have, can you share with me a bit about what brought you to the Philadelphia START program launch, wearing the hat that you wear?
So the patient population that we serve, before we go into that, I thought it was important when we met. I loved the message that you delivered, and it appears that you are an individual who really cares and passionate about the work that you're doing. And I think you're doing phenomenal work. You highlighting the intellectual development delayed individuals who, where I saw was hyphenated the mental health component, because oftentimes that aspect is not addressed. So I knew explaining what we do and telling you about our facility was one thing, but I knew it would be more impactful if you had the opportunity, which I'm very grateful for, to come see what we do. And I say it because putting the patient experience first is just as important when we're meeting them at where they are. And the reason I ended up at this launch program was because I thought this is another opportunity to create opportunity for those who need, but most importantly, taking the time to actually identify additional resources to what we already have to allow patients to be more successful.
And it was so clear as I met your colleagues, the people that you supervise, but I also heard from you, these are people that were your peers before you moved into a supervisory role. And that was so important. And the respect in those hallways was not just amongst your colleagues, but it was for the people that you support as well. As I was walking through, I saw so many similarities to the values in the START program and the things that we try to embody within our service delivery and our mission. As you sat through our START launch, what did you see as similarities of values or goals between the work of the program in the program launch and then the work that you all do at Temple?
So I really appreciate the question because, and it's simple, caring for vulnerable individuals who need support, building a sense of belonging. And just because you may have a condition that you cannot do anything about, that's beyond your control, but it doesn't mean that we should limit the opportunities that you have to be successful when you're in this vulnerable state or your crisis state. Most people who are coming to a crisis center is probably not at their highest. And our goal is to try to have them feeling much better than when they first walked in the doors. And the goal in the doing that is just delivering the compassionate care that we all are here to do. And most importantly, when we think about it, just knowing that when you're caring for an individual, it's that feeling that financial assistance cannot provide. When you're caring, it goes a long way. When you think about the intellectually developed individuals who come in our facility, I find it challenging when I see that you're getting 302, and the 302 here in Philly is an involuntary commitment for a condition that you cannot control. That's very difficult because if the individual is at their baseline, what are we doing differently to help them meet them at that level other than involuntarily committing them? So that's where it instantly clicked when I saw your presentation.
I value that you are saying that we have to look at other options. We have to look at other
Absolutely.
options other than involuntary commitment. We call them IEAs here. One of the problems that we have is that we have so many different references. Everything's different in different states. It makes it really hard to follow. But you're absolutely right. Looking at different options, more humane options, more person-centered options. What I think that we're hearing, especially as we go to these presentations, we're hearing loud and clear that we know the statistics say that people with intellectual and developmental disabilities are statistically significantly more likely than the neurotypical population to experience mental health needs. They're also more likely to experience trauma in their lifetime. So with that being said, I am very hopeful that having professionals like you come to our program launches, come to our trainings, will give opportunity for continued partnerships to allow us to link together and ensure that people with developmental disabilities can be seen for their whole person needs. Because historically, when they go to the emergency room, sometimes their mental health needs can be dismissed or even in the community. So what I'm hearing you say, Marcus, is that you see the person. So when somebody with a developmental disability or intellectual disability comes to your unit, how are they supported?
I think just like anyone, we support everyone the same, but it's not a one size fit all approach because everyone is different. But we're still going to give you the dignity and respect as deserved, as evidenced by us building a crisis center. The planning project was almost 2 years, whereas the construction took a little over a year. And what that entails, we went from 4,000 to 14,000 square feet. But with the collaboration that went into this project, it entailed not only construction individuals, facility individuals, nursing had a huge influence in it as well. And what that meant was we're going to design more appealing approaches, less institutionalized presentation. So when a patient comes in, they can feel like they can be themselves. You're not closed in some dark, like the imagery, like sensory We try to be mindful in our design to make sure that we're meeting the patient needs by making it less stimulating, but at the same time, more healing. And the dignity was at the forefront. So essentially, that was our goal going in to designing this new facility.
At the end of the day, treat people as people. And that is how we model for others. And I'm so grateful for what you do. One last question to wrap us up. Knowing what you know now from the launch, what do you see as an opportunity for yourself or others in the crisis setting, or maybe other mental health professionals? But what would you see as opportunities to partner with programs like START?
I think the dialogue, when you think about it, it starts with a conversation to tap into the experts who have dealt with similar individuals. In order for us to deliver care at our highest, we need to know how to go about doing it the right way. And what more could you ask for to have this experience to visit START and learn from the experts? So now when we take the information back to our teams, we can help disseminate the education and the thought process in addition to the resources that are out there to help us deliver the best care we can for our patients.
Awesome. Thank you so much. And now I owe you a tour. So we'll look forward to you coming to visit us over in New Hampshire when it gets warmer. Marcus, I can't thank you enough for your hospitality, your partnership, your insight, and what you're doing for the Philadelphia community. I can only hope that others watch this and see how mental health and crisis work can be done, because we know not all communities have units like yours, but that doesn't mean that it's not possible. And so thank you for sharing with us what the possibilities are. And I do hope others will reach out to you as a resource. So thank you so much for your time.
Really, thank you.